Hi, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers. And today I want to talk about one of the sometimes overlooked aspects of neuropathy and how we assess it in our office, and that's balance. Now, you're probably familiar with the numbness, the pain, the burning, the cold, the tingling, a lot of the really active symptoms that can really destroy your quality of life, but can actually even be just as much of a threat to your quality of life as your balance. Now, as those nerves are damaged throughout the process of neuropathy, they'll start misfiring, and that's why you'll have the symptoms of like the pain, the numbness, what we talked about. But what will also happen is that you'll start losing your body's balance, or proprioception is the fancy term for it. Now, with this, you may have noticed this throughout your day, that it's harder. You have to really grip the stairs going up and down. You don't like walking on uneven surfaces. A big thing that we find from patients too is that when they're in the shower, they find it very difficult to close their eyes and wash their hair. They've always got to be stabilizing themselves. These are some early warning signs that you're having issues with your balance. Now, the way that this is typically assessed is just have someone try to stand on one leg, close their eyes. Now, that while a way to test for balance, we found that it isn't really the most accurate. So what we do in our office is what's called the balance tracking system. If you've noticed, I'm standing on a platform. Now, what this platform does is a force plate, and it actually measures your sway or your balance. So you'll stand on this plate, hands on your hips, and then close your eyes. And what this does is it actually measures your sway side to side, front to back, and it determines your center of mass. So let's see what that looks like right now. So as you see that yellow dot, what this is effectively doing is measuring my sway. Now, if I go side to side or front to back, it tracks that, and it's able to see really what my balance is like. Now, this isn't measured against everyone. This is measured against a normal population of people my age and gender. So when we do this test, we're not measuring you against a 20-year-old. We're measuring you against what would be a normal population. Now, the first trial is a practice, and then we do 3 individual trials, and those numbers are averaged. This gives us just a significantly better handle on what your balance is, and then also as it progresses throughout care. So as you can see, this is we found is a much more accurate way of determining your fall risk from the initial visit. And then also we do serial tests with this as we test as patients go through care to see how your balance improves. Falls are extremely concerning. The statistics say that for seniors who have a significant fall, almost 1 in 3, the all-cause mortality is about 1 in 3, which means if you fall, there's almost a 30% chance that could be the beginning of the end. So if you have neuropathy, or if you're having balance issues too, please reach out to our office. We'd love to see what we can do to try and help.